Joining us today. Good afternoon, everyone. Thank you for joining us today. My name is Ayami Hatanaka, and I am the Chief of Staff at Just Making a Change for Families, which is also known as JMAC for Families, which is a member organization of the Repeal CAPTA Coalition. I'm also a PhD student in American Studies, and my research focuses on family separation. For accessibility, we have closed captioning available, which you can turn on at the bottom right of your screen. If you have trouble locating it, please write in the chat and one of our colleagues can assist you. Also for accessibility, I am providing an image description of myself. I'm an East Asian femme-presenting woman with medium length hair. I am wearing a black top with a light blue cardigan and a smile. Today, I am logging on from the unceded land of the Lenape people, or Lenapehoking, also known as Brooklyn. As a coalition, we want to take the time to acknowledge that the family policing system is not only descended from the systemic breaking apart of Indigenous families and polities, especially through the Indigenous boarding schools, but that the family policing system continues to target Indigenous communities today. Our fight to repeal CAPTA is intertwined with the fight to end the separation of Indigenous families once and for all. Before I tell you about the Repeal CAPTA Coalition, we want to note that today is September 11th, and we would also like to acknowledge both the tragedy for the families and loved ones of those lost in the tragic events 22 years ago, as well as the way these events have been weaponized to surveil and target already vulnerable communities in the US. We note that the surveillance and policing of such communities is also tied into the surveillance and targeting done by the family policing system, and we cannot have liberation from one system without the other. Now, a little bit about the Repeal CAPTA Coalition, which is hosting today's webinar. The Repeal CAPTA Coalition is a coalition of impacted families, advocates, social workers, attorneys, and academics working to end the devastating effects of the Child Abuse Prevention and Treatment Act, or CAPTA, of 1974 on children, families, and communities. We seek to educate the public about the harms of CAPTA and to normalize a caring approach to the needs and aspirations of children and families grounded in respect for family integrity and autonomy. This approach must increase access to direct support and material benefits, eliminate the power and harm of the family policing system, support family integrity and autonomy, and promote healing and reparations for impacted children, families, and communities. You can learn more about the coalition by going to repealcapta.org, a link to which we'll be putting in the chat. Today, we're joined by an esteemed panel of experts who will educate us about the history of CAPTA. Of course, we won't be able to cover everything, so we can think of this more as an introduction to CAPTA, which will be followed by other webinars and panels in the future to learn more. This panel will be recorded, so please visit the Repeal CAPTA Workgroup's website to view it again or to share it with others you think would benefit from viewing it. Hopefully, time permitting, we'll be doing a Q&A at the end, for which we'll be using the Q&A function at the bottom of your screen. So if you have any questions that come up during the panel, please put them in the Q&A box, not the chat. And just as an update on our panelists, unfortunately, Tamia Govan, who was originally slated to join today's panel, is unable to join us. However, the wonderful Tatiana Rodriguez has graciously agreed to join the panel, and we are very grateful to her and excited to learn from her expertise today. Now, finally, I will introduce our panelists in last name alphabetical order. Kathleen Creamer is the managing attorney of the Family Advocacy Unit at Community Legal Services, or CLS, which uses a holistic family defense model to help parents involved with the child welfare system maintain custody of or reunite with their children. She joined CLS as a staff attorney in the Family Advocacy Unit in 2006 and served as a senior Stoneleigh Foundation Fellow from 2011 to 2013, spearheading a project dedicated to improving reunification outcomes for children of incarcerated parents. She is a member of the steering committee for the American Bar Association's National Alliance for Parent Representation and is also co-chair of the Communications Work Group of the Family Justice Initiative. Alan Detloff is a Mexican-American scholar, author, and abolitionist. Alan began his career as a social worker in the family policing system, where he worked as an investigative caseworker and administrator. Today, his work focuses on ending the harm that results from this system. In 2020, he helped to create and launch the Upend Movement, a collaborative effort dedicated to abolishing the family policing system and building alternatives that focus on healing and liberation. Allen is author of Confronting the Racist Legacy of the American Child Welfare System, The Case for Abolition, published by Oxford University Press in 2023. Michal Raz, MD, PhD, is the Charles E. and Dale L. Phelps Professor in Public Policy and Health at the University of Rochester and a practicing adult hospitalist at Strong Memorial Hospital. A scholar of the history of child welfare policy, she is the author of 3 books. Most recently, Abusive Policies, How the American Child Welfare System Lost Its Way. She has extensively published on the imperative to protect children and families from coercive child welfare intervention and the harms of conflating poverty with neglect. A sought-after speaker, Raz has been invited to testify before different legislative bodies, primarily on the topic of mandated reporting. Her new book examines the history of the Adoption and Safe Families Act and the push to elevate adoption as a desirable child welfare outcome. Tatiana Rodriguez is the founder and executive director of Family Matters First in Boston, Massachusetts. Through her work, Tatiana advocates for and empowers impacted parents to harness their voice and challenge the family policing system. In addition to her advocacy work, Tatiana is deeply involved in wider systemic change efforts. She is part of the Court Improvement Task Force for Massachusetts Juvenile Courts, where she harnesses her lived expertise to drive impactful change. She also serves on the Opioid Effective Youth Initiative Advisory Board with Massachusetts General Hospital, working to address the unique challenges faced by youth and former youth affected by the opioid crisis. As a first-generation college graduate, former educator, and daughter of immigrant parents, Tatiana's journey is a testament to resilience and transformation, and she looks forward to sharing her expertise and insights with you today, as well as working together to build a more equitable and just system for all families. Since we're short on time, I'll be just asking each panelist one question, but other panelists are, of course, more than welcome to add on. So, Allen, you've just published a book that I encourage all to read, Confronting the Racist Legacy of the American Child Welfare System, The Case for Abolition. And I'll note that you did a book launch webinar with JMAC, thank you, for which we'll put the link in the chat and a link for your book as well. In that book, you detail the racist history of the child welfare system in the US, going back to enslavement. Although we only have an hour, so we'll really just get the highlights. Could you help us understand the history of CAPTA in relation to the history of the child welfare system?
Absolutely. So thanks very much. First, thanks for everyone who's tuning into this webinar today. It's really nice to see so many people who are interested in this. So yes, as you mentioned, Ayami, it's important first to start with the history of family separations in this country, which began during the era of chattel slavery, where the forcible enslavement of Black children from their families was used intentionally by the state and through the state by enslavers to maintain the oppression, maintain compliance of those who were enslaved. It was following abolition of slavery that what we think of as the child welfare system today began. The origins of the child welfare system really began, the very earliest origins began in around 1853, when Charles Loring Brace, minister in New York, established an organization called the Children's Aid Society as a means of caring for orphaned, abandoned children who were living on the streets of New York. Brace believed that those children could both help settle the rapidly expanding West and through placement in care with rural families, grow up into productive adults. So that led to what's called the orphan train movement. And the orphan train movement resettled over 200,000 children from New York to the rural Midwest in the late 1800s to the early 1900s. And we often hear that the orphan train movement resettled over 200,000 children, but that's actually not entirely accurate. The orphan train movement resettled over 200,000 white children to the rural Midwest. Black children were intentionally excluded from all aspects of the orphan train movement. One, Brace fundamentally believed that Black children were inferior to white children, but also not just inferior, believed that Black children wholly would not be able to receive any of the instruction that his agency and the orphan train movement were intended to provide white children. He believed that they were fundamentally irredeemable. So that's really the racist roots of the child welfare system in this effort through the orphan trains to save white children from poverty while intentionally excluding Black children. Then we see the orphan trains end in around the 1920s, and the concept of child welfare really began in around the 1930s through the Social Security Act. And that welfare at that time was solely for the purpose of poverty relief for white mothers whose husbands had been either incapacitated or died, and so white widowed mothers who were unable to enter the workforce. Yet, as more and more Black families began to meet the eligibility requirements of what was now known as welfare, states started to implement policies to exclude Black families from being eligible to receive this kind of aid. So those things were often called illegitimate child clauses, or man in the house clauses that were used to either deny benefits to or expel Black families whose homes were viewed as immoral. And as probably the best example of that, in 1960, the state of Louisiana expelled 23,000 children from their welfare rolls, about 90% of whom were Black, on the grounds of unsuitability. That triggered enough attention to form the basis of the Fleming Rule, which essentially said that states could no longer use those eligibility clauses to screen out Black families. However, it also required that for all of the families who had been kicked off the welfare rolls, that those families be investigated to see if the children in those homes were safe. So what you have is tens of thousands of Black families, Black homes, who were both living in poverty and kicked off the state's welfare rolls, investigated by what was a largely, in the 1960s, white workforce. And then those Black children started to be entered into foster care because they were deemed unsafe by this white child welfare workforce. That's really the beginnings of Black children's rapid entry into the child welfare system. Then what you also see concurrent to that in the 1960s is national concern over severe child abuse that resulted from publication of C. Henry Kemp's The Battered Child Syndrome. Prior to the 1960s, most people didn't know a lot about child abuse, didn't really think about child abuse. The issue of parental discipline was not discussed solely in parents' hands. But in 1962, this became something that drew national attention. The Battered Child Syndrome was on evening news, on the front page of Time magazine, many other publications. And that led to essentially a child welfare panic and the beginning of mandatory reporting laws. As an example, in 1962, prior to most mandatory reporting laws being established, only 600 cases of child abuse were reported to law enforcement. By 1968, when mandatory reporting laws were established in all 50 states, that number had increased to 11,000. And the effect on Black children was immediate. In both 1967 and 1968, Black children were reported for child abuse at a rate more than 3 times that of white children. Specifically, Black children represented almost half of all reports, 45% of reports, despite the fact that they were only about 8 or 9% of children in the population. So then what we see is, with all of that knowledge in hand, CAPTA served as the final policy decision that would ensure those disparities continued. Despite a decade of evidence of the harms that were resulting to Black children and families because of mandatory reporting laws and the disproportionate reporting that was being done, in 1974, CAPTA not only enshrined all of those mandatory reporting laws at the federal level, it also for the first time classified neglect under this broader category of maltreatment, ensuring that reports based on poverty would continue. So when people often talk about the unintended consequences of CAPTA, they're not unintended. It's important to understand that those aren't unintended consequences. Policymakers had a decade of information telling them that Black children and families would be disproportionately harmed. So when you know that a policy will disproportionately harm Black families, and you pass that policy anyways, and then those disproportionate consequences become reality, that's not unintentional. That was known. It's also important to understand that that time in our history, it's not a coincidence that the rapid rise of mandatory reporting laws occurred during the exact same time in history as the Civil Rights Movement. This time in history, when you think back on it or look back on it, included some of the most horrific acts of violence committed against Black Americans. The lynching of Emmett Till, blocking of the Little Rock Nine from entering Central High School, the violence directed at the Freedom Riders, blocking of Black students from entering the University of Alabama, the bombing of the 16th Street Baptist Church, the assassination of Malcolm X. This violent backlash to the civil rights movement, as well as the widely held racial animus of that time, formed the backdrop to everything that was happening regarding the expansion of mandatory reporting laws. So what we see here, it's not just that these are intentional consequences, intentionally racist consequences of CAPTA. This is an example of what Carol Anderson calls white rage. Throughout our history, when white power is threatened, it responds with white rage. And at times throughout our history, that white rage manifests itself through horrific violence, as we saw during chattel slavery, as we saw during the civil rights movement. But at other times, when that overt violence is either insufficient or it's less supported by the broader society, white rage is enacted through policy. And that's what we see through mandatory reporting laws, where policy is used as a tool to channel white rage for the maintenance of white power. So that's the racist history of where CAPTA comes from.
Wow, thank you so much, Alan. Like that was just a really helpful and clarifying way to kind of trace how some of these ideas and these logics are being solidified into policy like CAPTA. And now I want to turn to Tatiana. Maybe you can talk a little bit more from the position of someone who has directly experienced the system, as well as someone who currently works with families who are experiencing it as well. Could you share your expertise on what CAPTA, maybe some of these not so unintentional consequences, looks like on the ground and how that's actually impacting families today, almost 50 years after it's been passed?
Hi, everyone. So what does CAPTA look like on the ground? So I would just say blatantly just like over surveillance of Black, brown, and low income families. When I worked in the public school system, I saw it every day. I saw this culture where people actually believed in like this or this fear of not reporting, and just not even thinking to investigate, not even thinking to make a basic phone call. I see parents that I work with being retaliated against, who have had problems with their children's school disciplinary actions. I see right now a parent that I'm working with being retaliated against due to her advocating for one of her other children's at a school placement, at a district school placement, as she was successful with the first one. So I see this culture where it's just this overly child savior, and it's like a fear of, oh my God, if I don't report, I can get sued. And that's all that's like being pushed. And, I see it with the social workers. I even see it at my son's school where in the language in his policy, it's like, oh, you'll have a CRA if your child's absent for 10 consecutive days. But then I thought about like, what about my immigrant family that I have that travels a lot? Sometimes there's a family emergencies. You may have to travel outside of a country, and what if you have 10 consecutive days? Now you have a CRA on you, which leads.
And what's a CRA?
A CRA is so when I was growing up, it was a CHINS. So it's like a child in need of resources. So they make you believe that you have to have a CRA in order to get like intervention with your child's behavioral issues. But they're using it as a way of, of over surveilling as well. Just like mandated reporting it's a 51A where you file abuse and neglect. Now there's another avenue where they can also target, Black, brown, and poor and low income families.
Thank you. Sorry, I didn't mean to interrupt you. Please continue.
No,
that was a helpful explanation.
Thank you.
Oh no, please keep going. You're gonna continue.
No, I'm done. That's
okay.
it.
Thank you so much. I really appreciate your kind of framing mandated reporting as almost like a disciplining tool or even a weapon that's being used against poor Black and brown families, what you're seeing on the ground, what you're experiencing, and seeing it both in a school setting as well as a health setting. And I think that's a really great way then to turn to McCall, as a doctor who's in these health settings, as a historian who's studied this topic, in your brilliant book, Abusive Policies, How the American Child Welfare System Lost Its Way, which I also encourage everyone to read, and we'll drop a link to in the chat if it hasn't been dropped already. In that book, you detail how historically mandated reporting has been something really crucial to look at to understand the surveillance of the family policing system. So I'm wondering, could you help us understand how has that been worked into CAPTA, and how does mandated reporting relate to the present moment?
Of course. Thank you. And I'm really happy to be here. And thank you to everybody on the panel and to those of you tuning in at home. I guess my book looks at mandated reporting as a really crucial part of the so-called child welfare or the family policing system that wouldn't function without it. And I think when you think about mandated reporting, you have to understand that this isn't an invented concept, and that it was created as a tool, despite, as Alan says, is it unintended consequences, or these are clearly anticipated consequences? But we kind of knew what would happen, and we decided to go forward with this. So it's a political choice. Even at the time it was implemented, there was no evidence to support it. Today, there's plenty of evidence to say that we shouldn't be doing that, and yet we persist. And so where does this come from? So again, just turning back to Kempe's discovery of child abuse in 1962, then there was this idea that child abuse is occult and that only certain people can maybe recognize it. And if you recognize it early, then you can intervene. So the initial idea was that only skilled observers might be the ones who detect child abuse. And indeed, initially, mandated reporters were primarily doctors because they were the ones who were going to recognize, maybe a physical injury or a fracture. And in 1963, the Children's Bureau publishes model statutes for states to develop legal requirements for reporting of child maltreatment. And they target primarily physicians. But states kind of take that and say, well, if some reporting is good, how about lots of reporting? That must be better. And so states start developing more mandated reporting, and some states even develop universal mandated reporting. But there's actually no evidence at the time that this is useful. But as states scramble to pass, and every state quickly passes a law, as Alan says, by the end of the 60s, every state has a mandated reporting requirement. And then comes the CAPTA, the federal law that sets the standards for expanded mandatory reporting. But while we were doing this, there was actually no data about mandated reporting, and there was not a lot of debate about what should be reported, who should report, what is reportable behavior. And perhaps the biggest gap was, well, what happens after a report, which seems kind of the most important part, right? Reporting is not about creating more reports, although to this day it actually is. So it soon becomes clear in the late 1960s and 70s that there is no plan. So what happens after a report is being made, and how should reports being addressed? And as early as in 1973, a New York nonprofit social services agency notes that, I'm going to quote, reporting should not be an end in itself. And it makes the rather obvious but necessary observation that an investigation of a child is not actually helpful unless some services are provided. So, all these things that we say today, that reporting is not useful, that we don't need to report a family to support a family. I'm going to shout out to JMac and her team. So all these things have been said for so long, and again, ignoring these voices is a choice. So contemporary child abuse policy interventions, they center on encouraging reporting and raising awareness, but not on the provision of services. And hotlines emerge as a preferred technology for implementation, mostly because they can accommodate steep raises in reports without paying any more money, without an increase in salaried positions. So from the very beginning, focusing on reporting and focusing on these hotlines is essentially a form of political theater. It's designed to look tough. We are doing something. We are having a hotline, but there is no plan. And I'm going to tell a couple of stories to illustrate it. And the first one is about Florida, of course. So Florida is the first state to implement a child abuse reporting hotline. And so in 1971, the state is publicizing a toll-free 24/7 hotline, and the reports start coming in. So as Alan says, there didn't used to be a lot of reports for child abuse in Florida. In 1970, there were 17 reports for child abuse, and then they go up to 19,000 the following year, which is not to say that 17 is the right number, but also not to say that 19,000 is a following number. But whatever the number should be, if there should be a number, there was no plan here. State politicians made no funding appropriation, they didn't provide resources to deal with the increasing reports, and there was no way to support these families. Still, Florida persists, and they launched a statewide awareness campaign asking, I quote, "Who would hurt a little child?" And these are ads featuring cute kids on televisions and billboards and the radio. And there's a tagline that always says, we report, you could save a life. And we have data from the time that says that most of these reports actually are focusing on hunger, on a disorganized family life, on alcoholism, abandonment, lack of food, clothing, or shelter. And these are the terms of the time. And they don't focus on physical abuse. But a 30-second radio spot in Florida says, presents us differently. And they say, who would hurt a child? Unthinkable. And then they say, but in Florida, over 19,000 children were beaten, battered, burned, raped, starved, tortured, neglected, and murdered. So maybe technically correct because you said the word neglected and that can kind of catch all. But this is one of the many times, and perhaps maybe the first instance, where you grossly overemphasize the prevalence of significant physical abuse and try to lump it all together with poverty, substance abuse, and material need in order to generate this huge number of reports to create increased interest and to kind of self-perpetuate the system. Look, there's 19,000 reports, all these kids are being abused. We should be doing more reporting. We should be having more hotlines. When in fact, there's a lot of kids who are poor in Florida that probably needed supports. And I'm telling this story because this is really, this is at the base of our family policing system, that we create this panic over children being reported. We inflate the numbers. We conflate poverty, substance use, and physical abuse, which is a very small minority, leading to more panic and more reports. And the 1974 passage of CAPTA helps perpetuate this expansive view of what's child abuse. And everything we don't like is child abuse. All kinds of emotional neglect have to be child abuse. And they use a carrot approach to encourage states to adopt broad legislation to define this child abuse expansively. And I'm going to tell one story about that. So a South Dakota state program applied for federal funding under CAPTA in 1975, and their application was deemed ineligible because a statute in South Dakota didn't sufficiently specify a mandatory reporting requirement for suspected mental injury. The South Dakota Attorney General says, no, I interpret the statute as requiring it. Mental injury can be included. But CAPTA said, no, that's not enough. So in response, South Dakota reluctantly changes their reporting requirement to include mental injury. So we're this push, it's coming from the top to try to include more and more situations that are now called child abuse and neglect and are now required to be reporting. Federal government can't legislate states' reporting requirements, but they can certainly incentivize them. And as journalist Richard Wexler has said repeatedly, the incentives are tiny. It's not a lot of money, but it's enough to wave a tiny carrot, and states scramble to comply with these requirements. And states are doing this in response to the government actively pushing for broader requirements at the same time that many child welfare researchers and legal scholars from the 70s and onwards are saying our reporting requirements are much too broad. They should be narrowed. We should be targeting physical abuse, and we should not reporting all these things. And they're like, yeah, we heard you, but we don't care. And so this has a big impact, and the numbers increase between 1976 to 1978. So the late 70s after CAPTA, we see an increase of almost 50%. And more than half of these reports are not substantiated, and only a very small fraction deal with physical abuse. And most of them are about situations that deal with poverty, difficult home life, and addiction. Of course, race is at the center of this, and data from 1978 shows the same thing that Alan was telling us in the 60s, that African Americans are the subject of a disproportionate percentage of reports. And also Latinos are disproportionately targeted, and income and race track closely, and both are associated with more reporting. Also, almost half of all reports of neglect were in cases of families in the lowest income bracket. So incomes under 5,000, which is well below the 1978 federal poverty level. So, you can't say, this is not, we're not conflating poverty and neglect when you're showing specifically that you are by essentially reporting so many poor people. So by the late 70s, it's abundantly clear that a policy focusing primarily on reporting disproportionately impacts low-income and minority families, and that only a small fraction of these reports are actually involving physical harm to children or detecting situations that are, what we think of as abuse. In 1978, renowned Yale child psychiatrist Albert summarizes a decade of many reporting requirements in a talk with a pithy title, "Too Much Reporting, Too Little Service." And he argues, like many before at the time, this is not like the abolitionists arguing, this is the mainstream, that definitions of child abuse are too broad, and that the epidemic of reporting is not actually helping families or children. But policymakers are adopting the opposite approach. And I have a bunch of stories that in my book that show how everybody was telling policymakers that this reporting is not useful. And again, they said, we hear you, thank you, goodbye. We're going to keep on doing what we're doing because this is, again, a political choice. But I'm going to tell one short story. In 1974, the Federal Office of Child Development awards a grant for the development of model legislation. And this is a big committee, 42 experts across the professional spectrum, led by legal scholars. And this is kind of a story, this work on the legislation was quite the journey. And they rate at the beginning, we thought that we need lots of reporting, but we spent all this time researching, reflecting, and evaluating the data. And we realized, and they rate this, that this was creating a, quote, system of reporting sanctioned and encouraged by the law, which it could invade and harm the lives of parents and children as easily as it could help them. So end of quote. So they spent all this time doing this research. They see too much reporting or not understanding the causes like poverty, unemployment, lack of childcare, lack of healthcare, lack of housing. Furthermore, and this is a problem that exists today, many reporters believe that once a report is filed, help is going to come. But we know that's not the case. Often a report is all you get. You get an investigation, you get an investigation, you get an investigation, but nobody gets what they actually need, relief from the oppressive material conditions that are leading to these investigations to be initiated. Services are often substandard and could result in the unnecessary removal of a child from their parents' home, but no plan for help. So this panel spends all this time thinking about it. They're funded by the government, and they say, we came with a broad view. We learned about it, and now we argue for narrow reporting requirement only in cases of severe physical injury or neglect. So they reached unpopular and unexpected conclusions. Accordingly, the book was ignored and forgotten. And this is one of many stories I show in my book about how we had data, we had thoughts about this, and it was effectively discarded, and an opportunity to think about our approach was lost. Which I hope kind of emphasizes that thinking about the history of our child welfare policies is useful because we can learn from what we've already done in the past to help inform current debates. But mandatory reporting emerges as a main legacy of 1970s child abuse policy. Again, despite a dearth of evidence of effectiveness and with lots of concerns about its unintended consequences or its clearly foreseen but ignored consequences. And till today, mandatory reporting is the mainstay of child abuse policy with very few critics. Nobody wants to be seen as against reporting child abuse, even though if you remove the mandatory reporting, you can still report. It's just not mandatory. But could we imagine a future in which we focus on the preventing of child abuse and not the investigating of family, of providing supports, not reporting, and actually developing a system that can swiftly and effectively respond, in cases of physical or sexual abuse in a manner that's fundamentally different than a response to a family's struggle with poverty or substance abuse? Why do we lump this all together? We've been doing this since the 70s, but this is not useful. Often when a child is physically harmed or something terrible happens to us out, then people on Twitter tag me and Alan to show us, oh, look, children are being harmed. And I was like, yes, we know that. That's because the system is not protecting children. We want a system that does protect children. We want children to be safe. We believe that the system as it stands does not protect children. Could we imagine a system in which we are protecting children and that we don't remove children after they've been hurt and we don't use the fact that children are hurt as an evidence of effectiveness, but rather use the evidence of children not being hurt to say, this new system in which we uplift families is actually working. If we repeal CAPTA and its harmful focus primarily on reporting, it allows us to imagine a future that's different, in which we protect children and work to uplift and support families without this mechanism of policing families and investigating families. There are certainly families who might need assistance with poverty, with material need, with substance use. There are children who could benefit from different kinds of non-punitive interventions. But we've lost that across the way when we've decided to use child welfare as a term that's interchangeable with investigations rather than protections. So I'll pause here, but thank you for giving this time to talk about the history.
Thank you, Mikal. And I think what you're really, really doing there and giving us that kind of history is helping us understand how this system is kind of getting its foot in the door into these families' lives, whether that's 50 years ago or today, and helping us really understand how that's all rooted in this history of policy and legislation. And so, Kathleen, I'm wondering if you can kind of help us understand that if that's the front end, what does that actually look like once the system has entered a family's home? There are so many aspects of CAPTA we could talk about that are many, many webinars and many panels, but really the two that are standing out to me today are this defining of neglect, tying it to the concept of abuse and poverty, as well as the concept of mandated reporting as kind of funneling families into the family policing system. So, you're someone who's been a fierce advocate for families impacted by the family policing system for many years. And as someone with legal expertise about the system, I'm wondering, can you walk us through the tying together of neglect and poverty in CAPTA, what the legal implications are for families, and what does that actually look like? What does that mean for people's experiences within their families?
Sure. And thank you so much for having me. I'm so excited to be here learning with everybody. So I think Alan and McCall really explained how CAPTA kind of develops the system of like surveillance, reporting, and intervention. And it does it for two concepts. One is abuse and one is neglect. But it's really important to understand CAPTA never defined neglect. It asked states to decide what is neglect, right? And so every state has their own approach, and most of them are really quite troubling if you look at them. And I'll give you my home state of Pennsylvania. We have done what a lot of states have done, which is to create an extremely ambiguous definition of neglect. So you are neglecting your child in Pennsylvania if you're not providing proper care for your child. I've spent my whole career litigating what is proper. If someone can tell me, I'd be very grateful to know, because it changes from family to family, worker to worker, and courtroom to courtroom, right? So we have this really vague, ambiguous definition that's at play in many, many states across America. And then other states, unfortunately, Pennsylvania did this too, have taken the kitchen sink approach. So not only have they created a vague, ambiguous standard for neglect, they've also thrown in the kitchen sink. So for example, in Pennsylvania, there's a bulletin out to all child welfare professionals saying homelessness is neglect, lack of hygiene, lack of clothing, that's neglect, lack of supervision, that's neglect, right? And so we have these like broad and vague definitions, and then we have these kitchen sink poverty related definitions of neglect. And CAPTA says you must surveil and intervene in those cases. But what CAPTA doesn't do is provide any resources to CPS workers to solve those problems, right? And so if you are being reported for homelessness, guess what? Your CPS worker doesn't have housing to offer you. If you're being investigated for lack of supervision, guess what? Your CPS worker can't pay for your childcare bill, right? And so what we see over and over again is CAPTA directing the surveillance and intervention, but not providing the resources that families need to resolve these issues. And so that is the underlying design and structure of CAPTA. And I've learned so much from Alan and McCall about how intentional and intended some of these consequences are. What I want to say to those on the call as well is it's not just poverty. I agree, right? There are families who are facing serious safety threats. And what I want to say to you is CAPTA exacerbates those safety threats, right? So when you have families who are met only in times of crisis with a surveil, report, punish, separate mentality, you are making those families afraid to come forward and ask for help, right? And so there are families who are experiencing safety threats. There are families who are experiencing precarity. CAPTA drives those families underground. It tells them, you will be punished if you come and look for help, because we will report you to child welfare authorities for doing so, right? And so if you're a mom who's experiencing intimate partner violence, and you may want to go try to find help, you need to be aware that whoever is helping you is likely a mandated reporter that will feel like if you have children in the house, they have to report you to the child welfare system. If you're a mom who has a child with an accidental injury at home, you are going to be terrified to take that child to the hospital for care, because you know the medical authorities are going to feel like they have to report you to CPS. If you are a mom who is pregnant and struggling with substance use disorder and you want help, you will be punished for finding help. Because guess what? In 2016, we amended CAPTA to say even moms who get healthcare, even moms who get medically assisted treatment and give birth under a doctor's care will be subject to a notification to Child Protective Services. That's inside of CAPTA, right? So over and over again, we see moms and dads, no disrespect to dads, who are struggling with actual safety threats in their own home, in their own lives, and CAPTA drives them away from help and makes it impossible to connect to the help that they might actually need. I hope that it goes without saying, this is really bad for kids, right? Kids are less safe when their families are driven underground, when their families can't come forward for help, when their families are punished for being in poverty. That is a terrible scheme if you care about kids, as everyone on this call does very, very much. It exacerbates family instability. It exacerbates any safety threats families are actually experiencing. And then what I see in my practice every day that is just so devastating is it creates intergenerational patterns of family separation and harm, right? We have designed this. We're 50 years into CAPTA, and we're seeing family after family, generation after generation go through this. 50 years into CAPTA means it's not too late to fix it, right? We have made policy choices. I wasn't born, but I wasn't too far from being born in 1974, right? And so it's not too late to fix this. And I just have a couple of thoughts about a way through. And then I would love to hear from the audience. I'm so excited to be in the room with so many amazing folks. First of all, it is astonishing to me how often I go into policy meetings. First of all, moms are never there. Moms are never at the table. But also, so many policymakers who have incredible amounts of power in the system have never spent the time listening to moms. I'm not an impacted mom. I've spent my career walking alongside of impacted moms, and everything I know I learned from impacted moms. And you can tell there are folks who just have never spent a moment considering what's it like if you're a mom who really needs help and you're afraid to go ask for it because you're going to be turned over to the family police. What's that like? So I would say listen to moms. In general, what I've learned listening to moms for 2 decades is what they really want is safety for their kids. What they really want is access to adequate financial support. And what they really want is access to a safe place to go where they're in crisis. And mandated reporting has taken away all the safe places for moms and dads to go. Since I have 1 more minute, I just want to say one more thing. There is a lot of conversation happening right now. There are a lot of folks who are very upset and threatened about folks calling out the harms of CAPTA. Lots of folks saying, look, maybe there were unintended consequences, but we meant well. What I'm asking, and I've had to do this as a person my whole life, and I'm still doing it, is to care more about your impact than your intentions. I'm asking everyone in this room, care more about the impact you're having than the intentions that you have. And be a learner. Stop being a knower. There's so much to learn out there. Pick up Alan's book, pick up McCall's book, be a learner. Don't be a knower. We have so many knowers who know best about children and are ignoring the consequences to people on the ground every day. This is a time for like deep, radical listening. We're all capable of it. Let's bring our humility to the table and let's do it.
Thank you, Kathleen. That was truly wonderful. I really appreciate the call at the end for us to not be knowers, but to be learners. And I would also just add, after you read Alan and McCall's books, reach out to impacted people because they are the ones with lived expertise. Talk to them. You know, they're like, every time I talk to someone with lived expertise, I learn something new. They are, to me, the #1 knowledge holders about this system. They're the #1 expertise. That they have the #1 expertise about this system because they've really seen it the most up close you possibly can. I want to turn now to some Q&A, if that's all right. And I think this first question will be really great for Tatiana, but of course, other folks are more than welcome to jump in. one of our wonderful colleagues on the Repeal CAPTA Coalition, Stephanie Glaberson in DC. She asks, and I do want to note, someone in the comments in the chat, I can't recall exactly their name and I apologize, but they mentioned that some of these families don't even need services. And so that's something to think about, is like the surveillance happening for folks who don't necessarily need more resources, but just need to be left alone. But going back to Stephanie's question, she says many folks think of CAPTA as a way to get families access to services and resources. Could you discuss why people might think that about CAPTA and whether that is true? McCall and Kathleen, I know you both touched on this briefly, but I think it'd be great to hear, Tatiana, your thoughts on this question.
So that's interesting because that takes me back to what a CRA is. So here in Massachusetts, child requiring assistance is something that is being pushed through like the family nurturing centers and the schools, doctors, all of these mandated reporters are told that if a child needs a specific service, such as if they're having behavior issues, and they need assistance, and they could be a single mom that has to, work a lot, and she just is confused and doesn't have, especially a lot of immigrant parents that I see think that this is going to help them, and this is not true. I know families that get these services. I've gotten these services on my own. I work with many families that they all get these services on their own without having to do this. And it's just a way, I feel like it's a manipulation tactic. And I feel like a lot of the people that I even worked with, they didn't mean harm, but when they started to get educated as to what CAPTA is and what ASFA is, they started to like open up their minds. So I urge you to like not just submit to what the culture is, and to speak up, because this is not, it's just wrong. It's like, it's genocide against, families. That it's exactly what it is, so resources, our families just really need resources. And the mothers that I worked with, a lot of the things that Kathleen said resonated with me. It's a big mistrust. If you really want to help somebody, you first need to build a rapport with them and have trust. And if this is not working, why are we not trying a different approach? You know what I'm saying? So there's not trust between, parents rather go to grassroots organizations and people that look like them and people that experience what they experience. They rather come to us rather than to therapists, because they're afraid if they really tell their therapist the truth that they're going to report. So all these places that we need resources, even though the resources may be there, if they are, it's like there's just no trust because of CAPTA, and it's directly rooted in it. And a lot of people don't know what CAPTA is or ASFA is and the financial benefits that come with it. So I'll yield right there.
Thank you so much. Everything you're saying about like this threat of taking a child, the threat of family separation, whether that's to force folks to get some kind of support that the state thinks they need, or whether that is really meant in a benevolent way, that I think is really clearly in the chat, it resonates with a lot of folks. I do want to uplift a comment from Joyce McMillan, the executive director of JMAC for Families, and for folks who don't know, is the person who coined the term mandated support. She writes, people who report know they are not getting help for the family. That is why they always report in secret and pray the family never learned they were the reporter. So that comment seemed to have resonated with a lot of folks in the chat. Just wanted to uplift that. Before we move to the next question, I just want to see if any of the other panelists wanted to add to anything Tatiana mentioned in her comments. Great, I agree, she nailed it. So a next question, maybe Alan, this might be one directly for you, but of course, again, others are more than welcome to chime in. Another colleague in Arizona, Marsh Neil Lau, she brings up the issue of how social workers continue to support CAPTA despite hearing how harmful the family policing system is. We will so I know that we will probably have another panel on this topic, but maybe we can kind of touch on this intersection of social work, family policing, and why do folks still continue to support CAPTA despite knowing the problems that it has?
Yeah, that's a really good question. I think that we're still at a place where people are learning about how harmful family policing is. I think there's for decades, the system has done a very good job of spreading a myth of benevolence, that they provide helpful services to families, that if a family needs help, you call this hotline and they get help. As Tatiana just said, as Joyce said in the test, that's not the reality of the system. But I think we're still getting to the place where people are starting to understand that. And I've seen that change rapidly just in the last few years, where people are understanding more and more the harms of the child welfare system. But we still need to do more to reframe that narrative about the myth that the system provides help. Social workers, though, particularly, I think, need to rapidly re-educate themselves about the child welfare system. They're the largest proportion of the workforce in the system, and they're the largest population or largest profession that perpetuates the harm of this system. Our code of ethics specifically says that social workers need to must take action against oppression, racism, discrimination, and inequities. That means that social workers must take action against the systems that perpetuate racism, discrimination, oppression, and inequities. And that includes policing, prisons, and the family policing system, where social workers are complicit in harm. So social work as a profession needs to rapidly get up to speed in where we are, where many other people who are involved in this movement is, and start to change their curricula and really educate their students about the harms of the system. And then ultimately, social workers need to leave the system en masse, just refuse to continue to supporting it and being complicit in the harm that it causes.
Thank you. Thank you so much, Alan. Yes, please.
There's this idea that, that it's good to have lots of reports, because if we have lots of reports, we'll better identify better to bring all the reports in, and then we'll sort through them, as if reports are, a benign procedure, and also as if reports are like colonoscopies. If you do more colonoscopies, you'll catch more colon cancer. But it's actually the opposite. You do more reports, you are less likely to identify the kids who might actually need immediate intervention, because they might actually be at harm, because you have an overburdened system, and you stretch everybody thin in policing Black families and poor families. You might not catch the child who is being hurt. And we also know that the reporting investigation itself is harmful. But everybody's terrified that, like, oh, if we don't do this, we're going to miss, or children won't be hurt. And it's like, well, have you thought about how the system is already not identifying correctly the children at risk? Children are already being hurt, and that what you're actually doing is harmful in itself. And I also want to comment on for what Mr. David Lansner put in the chat also, which I think is also important to remember. We talk a lot about a lot of families who do need intervention, might need services and or different supports, but some families do need nothing. They're perfectly good families. They could use maybe some more money, but they don't need that. They're fine. Get off their backs. So it's easy to kind of believe that everybody's being policed could actually get supports. No, most of the people who are being policed could actually just go for not being policed, and that would be totally fine. Just let them parent, and that would be 100%. And then, and I think Dorothy Roberts says it before, what would it look like without policing? Well, it would look like my nice white suburb in which CPS doesn't knock on my door when I, walk the dog and leave the kids in the house, or my 2-year-old wanders down the street. And we could have this elsewhere, but we choose to police some people and not police others. And I think some social workers are part of that, because they believe that some people deserve policing. And I certainly see that with physicians, that they do believe that some people should be policed, or that families that disagree with them or pursue care with a different provider they disagree with deserve to be punished or intervened upon.
Thank you so much, McCall, and thank you for making sure. I think I was referencing David Lansner's comment earlier, so thank you for making sure that we gave him due credit. We have a lot of questions here and only about 3 minutes left to the end of our panel, so we're not, unfortunately, be able to get to every single one. I do want to directly address one question, which is how can we join your coalition? You could go to the repealcapta.org website and get in touch with us that way. Additionally, if we didn't get to your question today, you can also go to the website and ask the question there, and we'll also hopefully be having future webinars addressing more specific topics within CAPTA, and so hopefully you can tune into those as well. So just as a last question, really anyone can jump in here. This one is from an audience member named Michael Sinclair. Do you think that this movement can benefit from a new branding campaign? Branding campaign is in quotation marks. Many people are unaware of the damages of the child welfare system.
I think about media messaging all the time, although I'm no expert. I think that's what we're doing today, right? We have to learn from each other. We have to teach each other. We have to write books and read each other's books and put out webinars and listen to each other's webinars, talk to the media, talk to reporters. I do think we are in the middle of a sea change right now. Folks really are starting to grapple, and I'm so grateful for those who are like really willing to grapple and consider the harm. It is a really, really exciting time to be doing this work. Go to the Repeal CAPTA website, and guess what? You guys are on Twitter too, right? Go follow it on Twitter. This is the work of messaging, and please join us.
Awesome.
Would anyone else like to chime in? We have about 1 minute left here.
I wanted to add something that Mikal said, if you don't mind. I wanted to add to it that many times I also see that like CAPTA is so harmful to the point that instead of helping families now, they're making, once you get a 51A filed on you and you have an active social worker, you have to jump through hoops, which you can have a job, be in school, and now you have to attend these programs that maybe you don't even need because like some people know how to cope through things, especially coming from the community that I come through. I've been through a lot of things at an early age, especially being intergenerational. Like I have intergenerational involvement with the child welfare system. And many times they put us in a more vulnerable situation where we do become, less financially free. We already have setbacks, right? And then now we're in this system where somebody at school reported me, or maybe my neighbor retaliated against me and just falsely, because there's a lot of brainwashing around what child welfare is. And I think that it's our duty as people that really care, is to speak the truth. The numbers do not lie, and if there's data that's supporting that this is not working, we have a duty to speak up against it and stop being afraid, especially right now, and at the end of the day, I feel like if we submit to, just, oh, this is my career, or I'm afraid, being afraid is not going to save, what your purpose is on this life. Like, at the end of the day, I feel like this is my purpose. I went through it so that I can speak up against the truths of it. I didn't realize how harmful it was until I actually became an adult. I remember having to advocate as a child in the system to get my basic needs met. And these are people that swear that they're saving me. Actually, they put me at greater risk. And they could have helped my mother with resources and also with better healing and services as far as substance misuse and better treatment centers, and not just it's just all a part of these systems that are meant to oppress Black and brown people, period. So thank you so much. I can go on and on, but I just thank you, everyone, for what you contributed to this and for everything that you're doing, because this is I see this impact my community every day, and it's not easy. It's not easy seeing the harms and the trauma and the more trauma that for the sake of child savior and white supremacy.
Yeah. For too long, there's been too much shame to talk about it, and there's nothing to be shamed. So many parents are experiencing this, and we're lucky to have brave parent advocates who will use their voice to help make a positive change.
Thank you.
Well, thank you. Thank you also, Tatiana. I would love for you to go on and on. I could talk to each and every one of you one-on-one for hours about this topic and learn so much more. But as I've been facilitating this, I've just had to remind myself we're just here to scratch the surface. We're just here to really kind of get an introduction. And so hopefully we'll be having more conversations in the future to dive a little bit deeper. Unfortunately, we're out of time and we'll have to end here. But please be sure to stay up to date for future panels and events from the Repeal CAPTA Coalition in the future. There have been a number of links, books. I saw other folks were recommending a slew of other books in the chat, including Dorothy Roberts' work. Please check those out. So thank you so much to our panelists for such a brilliant and vibrant discussion. Really appreciate each and every one of you making the time to be here. Thank you to the Repeal CAPTA Work Group for hosting the webinar, and thank you to staff from JMAC for Families for the technical assistance. And lastly, thank you to you all for being here. We are wishing you all a really great and wonderful rest of your day. Take care.
Thank you.